What's a medical problem that people constantly ignore until it's too late? I had very irregular periods for years. I'm talking 3 months without one, followed by going for a month and a half straight. I went to one guy I know and they did an ultrasound but didn't see anything. The lady who performed it literally shrugged it off. I just thought maybe it was a byproduct of getting my period at 8 or 9 years old. Earlier this year, I went to a different gyno to get a bilateral salpingectomy. He noticed my hemoglobin was at about 7.4, and I told him about my irregular, increasingly heavy periods. He, too, found nothing during the ultrasound but elected to do a D&C during my bisalp. Come to find out, I had stage 1 uterine cancer, which luckily was resolved with a total hysterectomy. All right, a massive shout out to the second doctor who, upon finding nothing on the ultrasound, decided, hey, you know what, I'm going in anyway. He's the MVP of not trusting technology. Story 2. I'm an ER doctor, so there's a lot I could probably add here, but there are 3 that come to mind. Abrupt changes in exercise tolerance, especially in young healthy people. If you run 10 kilometers every day and you're suddenly winded after 5 kilometers or you're getting terrible leg cramps in one leg every time you work out, you should be assessed. Just because you can still run doesn't mean you don't have something going on. It means you're healthy enough that your body is capable of compensating really well. The last 2 cases like this I saw were a pulmonary embolism and a post-viral cardiomyopathy from a mild COVID infection, both in young, healthy runners. I've also seen cancers present this way. Unexplained weight loss, especially in larger people. They're pleased they're losing weight so they don't get it assessed. I wouldn't run to the doctor for a few pounds weight change, but if we're passing 5%-ish body weight loss without a clear behavioral or medication-related cause, this should be looked into. Red liquid in your stool. Even if you have hemorrhoids, even if you're young, do not ignore that in your stool. We are actually seeing an increased diagnosis of GI cancers in people under 40. Any red liquid in stool without an obvious fissure that I can see gets sent for a colonoscopy. Story 3. Mental health. A lot of people either refuse to or don't understand that mental health can physically affect a person's body. It quite literally causes stress not just on your nervous system but other vital systems like the immune system. This consistent stress can take a severe toll on one's health over time. Everything is connected, but it's still one of the most underestimated aspects of holistic health. A good but heavy book to read or listen to on Audible is The Body Keeps the Score by Bessel van der Kolk. He's a Dutch psychiatrist. It's a great book, and it's been helping me process my brother's recent incident. Story 4. Signs of insulin resistance, the big one being waist circumference beyond the recommended measurements, over 35 inches for women. I was moving towards type 2 diabetes and thought I was doing fine with exercise until I started having atrial fibrillation, AFib, several times per week. That's when I had to really get on track with my dietary choices. If I hadn't developed AFib, I probably would have just kept going, thinking I'd just always be a little overweight and it was no big deal. This path likely would have led to diabetes and potentially a stroke or a heart attack. I'm actually glad my heart gave me this warning that I could not ignore. Story 5. One thing people ignore until it's too late is chronic stress. It develops slowly. At first, it just feels like normal life. You have work pressure, bills, family responsibilities, and you keep telling yourself everyone feels this way. You push through it because that's what you're supposed to do. You think you'll rest once things settle down, but they never really do. Meanwhile, your body is under constant strain. Your sleep gets worse, your appetite changes, you feel tense all the time, and you stop enjoying the things that used to help you relax. Over time, your pressure rises, your immune system weakens, and your mood starts to decline. Then one day, the accumulated stress catches up to you, and your body forces you to slow down or stop. The hardest part is that you basically usually can't see the internal effects happening. There's no obvious warning sign, but the toll adds up quietly. Taking care of yourself early, even in small ways, isn't a luxury. It is essential maintenance. You only get one body, and it needs rest just as much as it needs effort. Story 6. Persistent sinus issues. I used to get persistent sinus infections all the time as a young teen, likely due to allergies and nasal polyps. I had one particular infection that would not clear up. I went to the doctor's office twice and was dismissed with the reason being, it's just a bug that's been going around. That was incorrect. I ended up in the emergency room. It turned out it may have started as a sinus infection, but it had progressed to a serious internal infection. The same thing happened to a family member 15 years prior. A few years after my experience, a student at the high school I attended passed away from the very same complication. Story 7. Not necessarily ignored, but not taken seriously in my mom's case, chronic pain and swelling. For about 6 months, my mom had chronic and worsening stomach, abdominal pain. She initially assumed it was diverticulitis, which she had dealt with before. Doctors often dismissed her concerns, attributing them to her being significantly overweight. Then came the abdominal swelling. It started subtly at first, but the doctors didn't think much of it, assuming she had simply gained more weight. It turned out to be ascites, which was causing both the pain and the swelling. These symptoms eventually led to a complete bowel obstruction that landed her in the ER. The underlying cause of the asides was stage 4 gynecological cancer. She managed to regain her mobility after being bedbound for 2 months but passed away after about 9 months of treatment. Please, if you're having any symptoms like hers and the doctors are not taking you seriously, push back, advocate for yourself. I sometimes wonder if things would have been different if I had pushed her to go to a different doctor or not accept the dismissive answer that her weight was the only issue. Story 8. Massive bruising after a leg injury. When I was in my mid-20s, I dislocated my right knee while at work. I've since been diagnosed with joint hypermobility. This was around 1983 or so. Back then, it was no work, no pay, and I had a wife and a family, so I just wrapped it up and went back to work the next day. The leg developed extensive bruising from mid-thigh to mid-calf. When I told my family doctor about it, he warned me, don't ever do that. With that kind of deep bruising in a leg, you could have developed a clot. At that age, you think you're invincible though, right? Story 9. My primary doctor dismissed my concerns when I started experiencing hair loss, feeling cold, significant fatigue, shakiness, hair matting, and oversleeping. My doctor told me that I was just having anxiety and tried to prescribe me Xanax. I was also experiencing other symptoms like irregular periods, and I asked if I could see an endocrinologist because 2 months prior, I went to the hospital and they found that my thyroid stimulating hormone, TSH, level was over 5, which indicated a hormone deficiency. He dismissed that information and told me that I was simply having anxiety, stating that anxiety could cause all of those symptoms. He also said I didn't need an endocrinologist because he was all I needed, and he failed to refer me to a gastroenterologist despite my family history of gastrointestinal problems. My insurance plan did not require his approval, so I went directly to an endocrinologist. I described my symptoms, and she noticed that I had some chin hairs. Based on my symptoms, she suspected I had hyperthyroidism, polycystic ovary syndrome, PCOS, and Hashimoto's disease. A test confirmed all 3 conditions within 3 months. I am now taking thyroid medications and metformin. I found a new primary doctor. It's clear now that my symptoms were not all in my head. When your thyroid hormone levels are low, you will have the symptoms I described, and combined with PCOS, it's a significant challenge. I've been doing better since then, but it's unfortunate that the previous doctor failed to properly investigate my health. To make matters worse, I found out that the Xanax he prescribed would have negatively interacted with one of my existing medications. I also learned that he failed to diagnose another patient with cancer. He actually celebrated when that patient was losing 60 pounds in 1 month. The patient was later diagnosed elsewhere and passed away just months later. Story 10. In my country, a significant health concern, especially among men, is heart problems. There's a cultural stigma that sometimes causes men to view tending to their health as a sign of weakness, which can unfortunately lead to serious consequences. If a man checks his pressure or takes regular medication, he might face ridicule. Consequently, many feel that they must take their medications in private. Similarly, if a man is ill and misses work, he may be labeled as unfit or weak. This societal pressure primarily affects men over 40. Thankfully, the current generation is moving away from these outdated prejudices. In my country, many men over 40 experience fatal heart attacks or strokes. These outcomes might potentially be avoided if they had access to regular cardiological examinations and a simple electrocardiogram. Story 11. Most of them. I used to work in a cardiovascular intensive care unit, ICU, and there were far too many patients who would experience a decrease in exercise tolerance, reduced overall function, and low energy levels, yet they wouldn't seek care for weeks. I'm referring to situations like sleeping downstairs on the couch because they couldn't climb the stairs to the bedroom without becoming severely winded. Rapid weight changes, unusual swelling, and drastic changes to your bathroom habits all need to be checked out by a professional. Story 12. While not something people constantly ignore, I just want to post a crucial reminder. Women's signs and symptoms of a heart attack often differ from men's. I'm a cardiology technologist, which means I'm the person performing ECGs in the ER and often the first to see if someone is experiencing a STEMI, a severe type of heart attack. I've seen female patients arrive with symptoms like severe abdominal pain, jaw pain, shoulder pain, or back pain, and they're often surprised to find out they're having a heart attack. Please get yourself checked out even if you're not experiencing the typical crushing chest pain or extreme shortness of breath. Story 13. I'm a family doctor in a rural area of one of those Midwest states where the cities are very blue but the countryside is very red. The biggest thing I struggle to convince patients to treat is high cholesterol. We changed how we approach it within the last 5 or so years, moving from focusing on a specific lab number to using a combination of that number with many other cardiac risk factors. This gives us a percentage risk of developing atherosclerotic disease over the next 10 years. What I frequently hear is information from social media about the supposed risks of statins, claims that they cause issues like dementia or even increase the likelihood of heart disease. This is simply misinformation. While the medications do carry risks, those risks are vastly outweighed by the significant benefits appropriate patients receive from taking them. Another perspective I'm hearing increasingly is that the medical guidelines are designed to benefit pharmaceutical companies and me financially. This is illogical. Consider this: a medication that costs $15 a month for 30 years is roughly $5,400. Compare that to a hospital stay for a serious myocardial infarction, MI, that may require a 4-vessel bypass surgery, potentially costing hundreds of thousands of dollars. The key is that these medicines work cumulatively, so the longer a patient is on them, the greater the cardiovascular benefit they receive. What's truly disheartening is that I'm starting to see a split along political lines. My openly Trump-supporting patients seem more likely to distrust what scientists and groups like the AHA, the CDC, etc. tell them, preferring to believe something they hear on TikTok, Facebook, or X. Story 14. I just had an emergency appendectomy. For about 2 months, I had been experiencing what I thought was just bloating and a general discomfort. I told my doctor about it, and he suggested it might be a muscular issue. 2 months later, I started feeling even more significantly bloated, though I had no fever or other typical symptoms. 2 days before the appendix ruptured, I told my wife something didn't feel right, and if it continued, I would get it checked out. I didn't. I went to work still feeling very bloated and uncomfortable. I mentioned to my manager and coworkers that I wasn't feeling well and might go to the VA urgent care, which happened to be about 5 minutes from the hospital where I work. I should mention that I drive for this hospital and my routes often involve long distances and remote areas between stops. I started feeling very strange. I called my manager and said I wasn't going to be able to complete my route and would have to return to go to the hospital. He gave me a hard time about coming back, which later became an issue for him regarding making me finish the route. To get to the point, I went to the hospital and went through triage. I was in the most intense pain I had ever experienced, and the staff worked quickly to get me assessed. My appendix had ruptured. It took some time to get me to surgery, and afterward I had to wear a JP drain for a while because the infection had spread into my abdominal cavity. After surgery, the doctor came in and said I was very fortunate to have come in when I did. You should not ignore the symptoms of a ruptured appendix. He said I would likely have been in a remote area when the event occurred, and if I hadn't come in and decided to continue with my route, it could have had a very serious outcome. If something doesn't feel right, go get it checked out. Story 15. Diabetes can significantly shorten your lifespan, and your quality of life toward the end may be severely diminished. Sleep apnea can damage your heart and kidneys and contribute to an earlier departure. High BP can lead to a stroke, which can severely reduce your quality of life, even if it is not fatal. Cigarette smoking slows healing and causes damage to your vessels, leading to various related health issues beyond the well-known lung diseases. Recreational IV substances seriously harm your vascular system, which is a key reason many who use these substances develop chronic wounds, especially on their legs. While IV substance use is clearly harmful, this specific consequence is often overlooked, and the vascular damage may not fully resolve after stopping substance use. Alcohol is toxic, and even small amounts can have negative effects on your health. Consuming alcohol is genuinely detrimental to your well-being. Story 16. Depression. Everyone thinks it's not that bad since you can't actually see it. And sure, there are helplines or health institutions you can go to, but most of them are one-off or treat you like you're insane. And the most treatment you get is a bottle of pills to take. That's like sending someone with a broken arm back home with a bandage and telling them to wrap it up themselves, then it'll get better. It will not work. Even if you have terrible, low-functioning depression, you are still expected to go to work, go grocery shopping, cook meals, and act like everything is perfectly fine. People don't understand that depression is a literal sickness. At my worst days, I wasn't even able to get up to brush my teeth. On my best days, I wasn't able to get up to shower. I didn't eat, I didn't sleep, I would go days without even getting up to go to the bathroom. I didn't take care of myself, I didn't shower, I didn't change my clothes, I didn't brush my teeth. All I did was sit around because I was stuck. I was sick, I had no help. No matter who you tell, how much help you try to get, and even then it's hard enough because sometimes it's so bad that you don't know how to reach for help or you're too numb to even try. And in those cases, you fall through and completely shut down. The most anyone does for you is tell you they hope you heal, and that's assuming you've told them about it, because depression is invisible and no one knows you have it until you tell them. So unless you do, which again is hard enough to work up the courage for, and even if you do tell people, a lot of them will say you're just overreacting, then people treat you like nothing is wrong and sometimes act nasty to you depending on how depression affects you. If you haven't showered, they treat you like dirt. If you don't have the energy to be nice, they call you a prick. If you're so numb and tired of life that all you can do is sit around in your bed all day, they'll tell you that you need to stop being so lazy. People only care when it's too late. When people can't take it anymore and they end their suffering, then it's all about, we had no idea, when you either never asked, never cared to notice, never even checked up on them though there were signs, or it's, oh God, bless their soul, when you were the ones who used to make them feel miserable and treat them like trash because of how they were struggling. So many people are expected to just carry on in life when they have depression. It's not just feeling sad, it's a sickness. It's a psychological disorder. You literally cannot do anything or feel anything. Story 17. Dental hygienist here. Periodontal disease is brushed off frequently by my patients. It's very common for me to hear, well, eventually if my disease gets bad enough, I'll just get dentures. It's not until they get those dentures placed that they realize the severity of the change. The constant discomfort and adjustments needed for dentures is a nightmare. The porcelain teeth do not cut through foods like enamel does, so your diet also changes. Brush twice a day. If you can afford it, please invest in a Sonicare or Oral-B electric toothbrush. Floss once a day. Make sure you are getting below the gums when you floss. This is best achieved by shimmying your floss like a bath towel on your teeth. If you wake up with headaches and sore teeth, first make sure you aren't dealing with sleep apnea issues and then go to a dentist and get a night guard made. My patients are losing their teeth via clenching and grinding more than to decay and periodontal disease. A simple night guard will save you from enamel on enamel trauma and will save you thousands down the road for a pair of cracked or worn teeth. Story 18. Late to the party, but constipation. I've always had it my entire life, but I upped the fiber and everything was fine. I had my gallbladder removed, and 10 days post-op, I had the worst constipation and upper right quadrant pain. The pain was below my ribs. I went back to the ER and the same surgeon saw me. She said it was a perfect surgery and I need to be tougher. It's part of the healing process. I work in the GI field as a sales rep, so I call a friend who is a GI doctor and tell her my symptoms. 40-pound weight loss. I'm 6 feet, 160 pounds, 38-year-old male. Nausea, pain, and constipation. She did a panel and my liver enzymes were through the roof. She gave me an extremely high dose of antibiotics and did a colonoscopy. 3 days later, I felt almost back to normal and most of my symptoms were gone. Turns out I had a really bad infection that was spreading from the surgery. Moral of the story, don't ignore anything. If you feel off, get looked at. Your body knows. And if you can't afford it, screw it and get looked at anyway. Don't let your government put a price tag on your life. Story 19. Often the people doing the ignoring aren't the patients, but the providers. My father was in a rehabilitation facility after back surgery. He suffered from Addison's disease, when your body does not produce cortisol. He started experiencing debilitating pain. He told the nurses, I think I'm having an Addisonian crisis and need to go to the hospital. They told him he was fine. I don't think they even knew what an Addisonian crisis was. The pain got so bad, he eventually called 911 himself. When he got to the ER, the doctor told him that if he waited any longer, he would be gone. Not that it makes his insistence any more valid than anyone else's, but my father was a doctor. Years later, when he actually was suffering, I felt that sometimes worked against him. He would use medical terms. For example, the pressure ulcer on my posterior calcaneus is excruciating. And it seemed like some of the medical staff had no idea what he was talking about or resented him for it. They'd dismiss his complaints, leave the hospital room, and he'd grumble, how the heck do they not know what my posterior calcaneus is? God, I miss him. And if you're enjoying the video too, don't forget to hit that subscribe and like button for more videos just like this because these medical terms are not easy to pronounce. Thank you very much. Story 20. I read this as mechanical, so WD-40 on hinges or other small house tool hardware that requires movement. Medically, I suggest sunscreen, sleep, water, multivitamins, stretching, and doing some movements each day that you don't naturally get in work or hobbies. A lot of preventable injuries come from over or underusing a part of our bodies, and this throws off the balance of the spine or range of motion as time goes on. Skin is the largest organ. If you can't visibly check yourself regularly, then find someone who can. Take photos of moles and seek a dermatologist promptly if something changes. Self-exams for breast tissue, anyone can get breast cancer. Self-exams for gonads, not for pleasure, press in areas to check for bumps or abnormalities. Don't lie to your doctors. They can't treat your unique bodies or minds if they don't have accurate information. Self-advocacy. Don't wait on your healthcare. Ask questions, take notes. If your pain or anxiety is ignored, then you need to find a new doctor and or add a therapist to help with finding better solutions for your specific needs. Be kind to yourself and fight like hell for your health. Story 21. Shoulder pain. My aunt had it for years but ignored going to the doctor despite her adult children and her husband begging her to go. Even her 2 grandchildren, adults, were registered nurses. Those 2 were the ones who convinced her to go just to go get a checkup. And she finally went. Then cancer. At the time it was found, it had spread to her lungs and into her stream. She passed away within 5 months of seeing the doctor. She tried chemo, but it absolutely stripped her of herself, so she stopped and chose to pass away at home surrounded by family. We miss you so much, Alice. The family, hers versus the general family, has fallen apart since then. We encourage each other to go see the doctor for any issues now. Had she gone to a doctor way back then, it could have been managed, but it was too late when she did finally go. Story 22. A bit of a cheeky reply, but settling for doctors who suck, dismissive, unwilling to work with you or explain things. Ask nearly any woman with any Undiagnosis how many docs it took to get diagnosed properly and how long she wasted on docs who did nothing to help. which not only leads to more suffering, but it can also cause scarring that affect fertility. It's hard to keep starting over, especially when you're suffering. But firing crappy doctors and getting better ones made a tremendous positive impact on my quality of care and life in general. If you're able, I know insurance, geography, energy, finances, etc. can make it far easier said than done or even impossible. Get a second or third or fourth opinion if the docs you're seeing are being unhelpful. Story 23. Nobody will see this probably, but mental health. I thought having depressive thoughts was normal, like everyone had them, right? So I refused to get checked out. Mental health is something everyone should be concerned about. Monitor your loved ones, ask them what's going on. If you notice something, say something. Story 4. Dental pain. Insurances don't pay out much. If it's a root canal with a crown, you know you're in for a $1,000 bill minimum, even with insurance. And the waiting list to see the only dentist within 100 miles who will take your insurance can be weeks while your infection just festers, grows more and more painful, and more likely to eat your heart valves. And they won't prescribe you antibiotics until the 2 weeks go by and they get you in the chair. Ridiculous. Can you tell I'm currently in pain and waiting for an appointment 2 weeks away for something going on in a crown/root canal tooth? Story 25. Burnout. It's not the same as being tired or being anxious, and if you let it fester, it will get harder and harder to fix. And the fix is not just rest or a break, it's totally reorganizing your life and reassessing what is and is not important and making those things fit. There's a stigma where people feel like they'll be judged if they say they can't cope or feel like they don't have enough going on to justify feeling that way. But we're all different and all having different tipping points. So once you've tipped over the edge, it's really hard to climb back. So please people, speak to someone. Story 26. I have a few. Women push to be seen if you have anxiety-like symptoms. It could be your heart. I lost a friend who was 45 to a heart attack. Her doctor kept saying, anxiety. I was heartbroken for her husband and 2 children. Also, stomach pain. My liver was shutting down to my gallbladder. I was turning jaundiced and puking up coffee ground like wretch. I was 21 at the time. I had to have a drip tube, which is lovely. Not. Arm pain in older men. It will lead up to a heart attack. Story 27. Basically anything that doesn't hurt. For example, high BP. I'm a physician and I've seen countless people who proudly tell me they haven't been to the doctor for years because they always felt fine. And they have BP like a pressure cooker. Also, patients who at some point ran out of their BP medication and didn't bother to get a refill because they were oh so busy, but they were totally going to go to their GP for a prescription next month, pinky swear. The thing is, high BP doesn't hurt you until you get a stroke or congestive heart failure. The same goes with diabetes. High sugar doesn't hurt, so a lot of diabetics don't really bother with keeping it in check. Even with stuff like diabetic foot syndrome, long story short, high sugar destroys the nerves in your limbs, so you lose your sense of pain in your feet. So you don't notice if you have any open wounds on your soles and just keep walking on them until they turn into bone-deep ulcers. I have seen patients who had toes amputated and the wounds wouldn't heal for months because high sugar also hinders wound healing, and they were perfectly casual and unconcerned about it and happily kept on eating jelly-stuffed donuts because it didn't hurt, so it couldn't be that bad. Story 28. Ehlers-Danlos syndrome. You wouldn't realize the amount of damage you do to your body until it's permanent and you can't do as much as you used to. A lot of people shake this off as clumsy, flexible, hypochondriac, or just some small sprains, dislocations, injuries, until they notice their body isn't properly functioning well with the most agonizing pain too. Sadly, there's no cure for this. I am one of those people who found out that I have it when my body was degrading itself with the amount of injuries I'm getting with small things. Story 29. From personal experience, acid reflux or GERD. My mother had worsening GERD for 2 to 3 years and just sort of gritted her teeth through it and took over-the-counter medication. When it finally got to the point where she was having more pain than she could reasonably manage, she finally saw a GI, a gastroenterologist, who gave her some more medications. When even those didn't do the trick and the pain suddenly got much worse, I took her to the ER, and one endoscopy biopsy later, she had stage 4 esophageal cancer diagnosis and was gone within a year after a very brutal and painful cancer process. In researching it later, I learned this is a pretty common thing with esophageal cancer. It's easier to ignore the symptoms as just acid reflux. And by the time it gets bad enough that you're getting the endoscopy, it's already metastasized. So personally, at the first sign of worsening acid reflux, I'm getting scoped. Story 30. Severe headaches, migraines that persist. I had a friend in college who was very healthy, didn't drink, and was actually a masseur. Very intelligent and kind. Years later, after we lost touch, it turned out he had a malignant brain tumor and passed away within a year of his diagnosis. He was poor and couldn't afford out-of-pocket healthcare at the time. Extremely rare, but I do always wonder if he would have gotten a brain scan or whatever technical term there is for that. It could have saved him. I have a friend with severely low iron that she has to get infusions. I'm honestly worried about her. Earlier this year, I had a severe pain in my side that persisted for 15 hours straight. All tests came back that my organs looked normal. I had some pain while whizzing and was afraid to go again. The pain got so bad I needed pain medicine plus another one injected. Thankfully, nothing was wrong, but the urgent care told me I should go to the hospital right away because if it was appendicitis or something, I could have passed away. $12,000 later, but I was so glad I went. It was stress-induced inflammation of my bladder. I was studying for a tough exam and in a toxic relationship. Story 31. When I was younger, roughly 11 years old, I suddenly started getting really out of breath from just standing up and walking a few steps. Like, I'm talking full-winded from doing this on top of extreme coughing. I was taken to doctors multiple times and they just kept giving me inhalers and some other medication. It took around 5 trips over 2 months until 2 trainees saw me. They took my heart rate before immediately dialing an emergency ambulance in quite a panic-looking state as I was only a few hours away from organ failure due to having very low levels of oxygen in my sample. Turns out it was undiagnosed asthma, so that was a fun time, lol. Those trainees were super grateful to me, however, as they had not gotten to see someone so close to passing away before, so apparently it was a really good experience for them. Story 32. Sleep deprivation. Everyone jokes about running on caffeine and 5 hours of rest like it's a personality trait. But chronic sleep loss wrecks everything: your heart, your immune system, your mood, your memory, or even your hormones. The scary part is how normal it feels until something breaks. You don't realize how bad it was until the first time you wake up actually rested and think, oh, this is how I'm supposed to feel. Story 33. Get your eye exams. I had stretched a year's supply of contacts for almost 3 and finally went in. They wanted to do the photos of the back of my eye, but it was extra money. They were kind enough to say, hey, you know what, we'll waive this fee. We really think you need it. They also tested my visual fields. I had no clue how much peripheral vision I had lost. The brain compensates very well. 2 weeks later, I had surgery for chronic retinal detachment. It meant I kept my vision, but it did worsen. The right eye had miraculously healed itself, but also had detachment. I knew my eyes sucked, but not how bad. Story 34. Something I've learned about pain recently. Doctors always ask you to assess your pain on a scale of 1 to 10, but I'm not sure how helpful that is. If you've ever had a particularly painful ordeal, your concept of 6 out of 10 pain might be a 9 out of 10 for someone else. So the question I ask myself now is this pain unusual? Muscle soreness from working out? Yeah. Bruised pain from being in klutz? Meh. Weird, unexplained stomach ache when you don't normally get stomach aches even though it's only a 7 or so? ER. Glad I did a few weeks ago. Bye-bye inflamed and infected gallbladder that was threatening to spread the infection to my liver. Story 35. Kidney disease. Chronic kidney disease, aka CKD. It can be found with routine lab tests, but how much of the general population is getting labs like metabolic panels? Even when people do get those labs, doctors don't think anything is wrong unless your creatinine is above X. That creatinine level is not what they need to be looking at. They need to look at the eGFR, which the lab calculates and includes with the lab report. There are a lot of people walking around with kidney disease without even knowing it. I know because I have CKD. 15 years ago, 3 doctors watched my creatinine climb and climb and climb, telling me I had nothing to worry about. I decided to get another look-see from specialists, so I drove 150 miles to Ann Arbor, Michigan to see doctors at U of M. Doctors in my local town had no idea what they were doing was totally wrong. Story 36. Oh boy, let me tell y'all a story. When I was 12, I had this little brown dot that appeared on the underside of my foot. I didn't think anything of it until about a year later when I got worried as it had grown a little. I showed my mother and she shrugged it off. 2 years later, when I was 14, I showed my dad and he took me to a doctor because I was worried. It had almost tripled in size. The doctor said it was just an abnormally large freckle and shrugged it off. Fast forward to the age of 15, I got worried as it was fairly large, larger than most freckles and moles, and went to the medical center at school. They had a doctor come in for me a week later. Turns out it was some sort of skin cancer. I got it removed and all is okay now. It's been a year and I'm doing mostly fine. Still angry that my mother shrugged it off like it was nothing, especially considering my grandfather and uncle both had skin cancer at one point. Story 37. I recently lost a friend to pancreatic cancer. Who knows what the first actual symptoms were? Abdominal pain, probably, maybe back pain, maybe something he wrote off as, I ate a huge meal and I'm in my 40s, this is normal. He showed up to his pool league and the guys there told him his eyes were yellow. He went to the bathroom and sure enough, his eyes were yellow. He went to the hospital, they ran tests, and that's when the tumor was discovered. He basically had lived in various medical centers ever since, and likely didn't get to spend much time in his own home. That was in January, and he just passed away 2 months ago. Story 38. Cholesteatoma. I lost my hearing in one ear while pregnant back in 2020. I didn't get it checked out or why it happened. Eventually, in 2024, my ear started an infection and liquid and a horrible smell was coming out. I had to see a doctor to get referred to an ear doctor. So many steps to this process. After a scan was done, I was told I had this disease and it eats away at my ear inside. After a 4-hour surgery of being under and cleaning this growth out, it came to find out not much of my ear bone was left to hear. I have another surgery for a prosthetic in my ear and hope to hear a bit better. It eats away bones and nerves near the brain. If you don't get it fixed, there are some serious issues. Story 39. In my country, dental issues. Dentistry is unbelievably expensive and doesn't fall under the healthcare umbrella. We do have universal healthcare, though. I don't know anyone that can afford to see a dentist regularly. I myself am going this week for the first time in 20 years. I'm 34, and I expect that I'm probably going to lose at least 4 teeth and spend a minimum of $3,000 to get my mouth healthy again. I do take pretty good care of my teeth, but I have a huge family history of dental issues. To do this, I'm having to borrow money that has been put aside for my kids' future, which I feel awful about, but I can't eat or drink without pain anymore and have no other way to pay for it. Even then, I know how lucky I am to have that as an option. Story 40. Diabetes, sleep apnea, GERD. Go see a dietitian and change your bad eating habits as soon as possible. I thought it was normal to be tired after a meal, diabetes, or after waking up, sleep apnea. I thought it was normal to get acid reflux daily. Then I changed my diet with the advice of a dietitian. I lost 25% of my body weight and reversed both my diabetes and GERD. Both diseases' symptoms disappeared instantly after changing my diet. I got a CPAP and treated my apnea, which is now treated with the weight loss. I now have 2 to 3 times more energy than before. It's not normal to have brain fog in the morning or to feel tired after waking up. Sleep apnea could have ended me because sometimes I was sleepy when I drove my car. GERD can be dangerous because my brother-in-law got cancer from GERD. And diabetes, well, the doctor told me it's really bad and I should lose weight. And I did. I have a lot more energy now. Diabetes is extremely bad because it messes up your energy levels, and I had a mild case at only 7. I barely got diabetes, and this is why I could reverse it. But I have friends who ignore it all. I'm afraid they'll pass away young because they don't take care of their health. We're not 20 anymore. I wish the food industry was making healthy food. Most of the stuff in the grocery store is unhealthy. Story 41. Moles and beauty marks that change shape from flat to bumpy or smooth edge to jagged. My dad had a mole on his leg for years. He was part of the generation that didn't wear sunscreen at the beach. He kept ignoring it until a neighbor who worked in a dermatologist's office said his mole was getting bigger. By the time he finally got it looked at by a dermatologist, the mole had turned into advanced melanoma that had already metastasized all over his body. There was nothing they could do. Somehow he managed to live 4 more years. When he started having seizures, doctors realized they had reached his brain. He slipped into a coma and then he was gone. I was 10. Put on sunscreen, then put on some more, even if it's an overcast day, and get checked out by a dermatologist at least once a year. If my dad had gone to a doctor early on, the mole would have been removed and he'd be alive today. Story 42. I have a history of migraines. Out of the blue, I started having really bad fainting spells. They were frequent. Once I was walking in NYC and crossing a busy street, I was getting extremely dizzy and fell literally flat on my face, knocking out all my front teeth. People were walking by when I came to and I heard someone say, "Stupid, intoxicated." Laugh out loud, I wasn't. I couldn't stand up and was hurting like crazy. A sweet young man stopped to help me. Long story short, I had a stroke. He ended up carrying me into the lobby of a building and calling 911. I had a bunch of tests that confirmed a stroke and extremely high BP. That was new. I'm in good shape, not overweight. I don't smoke or drink. They did find a small aneurysm on my brain but couldn't say if that was the cause. 3 months later, after being on BP medicine, I was watching a video in my bedroom and someone came to ask me something. I tried to answer, but gibberish was coming out, and I was trying to sit up but was stumbling like hammered. She looked at me and said, "OMG, you're having another stroke." Back in the ER. This time it was a much more serious stroke. I ended up paralyzed on my left side and unable to talk. This time they found a 90% blockage in my carotid artery, which they did a long surgery to scrape out. I was in the hospital for 3 weeks and a nursing home for 3.5 months trying to recover. It was really hard, but I have recovered, but it took over a year of constant therapy. The aneurysm is gone though, laugh out loud. So sometimes, no matter how much you do to take care of yourself, genetics can play a part in things anyway. I have changed my diet to an anti-inflammatory diet, which is super easy and good. Basically, much like the Mediterranean diet. I feel great now, but I've slowed down quite a bit. I'm not as strong as I was pre-strokes. Story 43. I have incredibly severe acid reflux and an undiagnosed GI thing to the point where when I had an endoscopy a few years ago, I was just straight up riddled with ulcers from my esophagus to my duodenum. After they went away after several months on very strong medication, my doctor just stopped giving a care about what was causing them in the first place. She did a couple of rounds of tests because my inflammation markers were off, but then after that, she basically just threw her hands up and was like, The ulcers went away, and you can probably just take this medication for the rest of your life, so what's the problem? I know I need to find another doctor who actually cares about the cause and not just the symptoms, but it's just exhausting. Story 44. Heart disease, diabetes, or cancer. Don't wait until you're suffering to see a doctor because it could already be too late. Don't be that person that waits until they can't get up to see a doctor. Diabetes runs in my family. I have it, my mom has it, and my brother may have it. Mine was literally caught because of health complications with pneumonia, but my doctor thinks I've had it for a while. My mom's was caught after she already had heart disease. My brother's been eating like a slob since getting diagnosed as pre-diabetic. At this rate, he'll probably catch it when he starts losing his eyesight or they have to take off one of his toes. Story 45. I was on a nighttime flight and I was flat out exhausted. I'd had a long week with lots of pressure. I noticed what seemed like a tiny sparkler in my right eye. I figured it was just me, just being overly tired of the fact that I was sitting in a window seat and maybe the lights on the wing were bugging my eye. I went home, went to sleep, and was at the eye doctor by 10 a.m. She had me in to a retina specialist by 12:30 p.m. I had a torn retina, but it was not fully detached. 6 months worth of laser surgery right there in the office, and I was on the mend. The retinal specialist told me the difference between torn and detached is time. I'm thankful to this day those front office staff who got me in and quickly. And if any of these stories got to you too, here's more for us. YouTube thinks we're going to love this. I'll catch you in that video.